Welcome to the Pharmacist-Directed COVID-19 Testing and Training Program, Part 2. This program is brought to you by NASPA and the Connecticut Pharmacists Association. Glad to have you. Our learning objectives for today are to understand the current state and federal laws pertaining to ordering and administering COVID-19 tests, to describe appropriate finger stick blood collection, identify the role of PCR versus antibody testing and appropriate counseling on results of either, and develop a strategy to bill for COVID testing. A couple of quick disclaimers. Neither NASPA nor CPA have endorsed any of the specific COVID-19 tests, including any of those that are mentioned in this program. It is the responsibility of the billing entity to verify proper billing codes and eligibility with CMS, and references to specific companies and tests in this training are for educational purposes only. So let's start out with how pharmacists have authority to do testing in the first place. On April 8th, Health and Human Services issued guidance authorizing licensed pharmacists to order and administer COVID-19 tests, including serology tests, authorized by the FDA. Pharmacists qualify as covered persons under the Public Readiness and Emergency Preparedness Act and may receive immunity with respect to all claims for loss caused by, arising out of, relating to, or resulting from the administration or use of FDA-authorized COVID-19 tests. On April 28th, further guidance was delivered covering tests under Medicare and Medicaid and specified that you do not have to have an MD to order the lab test and clarified that pharmacists were authorized to do this specifically. And then on May 19th, HHS issued an advisory opinion clarifying that pharmacists are authorized to order and administer FDA-authorized COVID-19 tests in states where they were not authorized to do so. To the extent a state expressly does not allow pharmacists to administer this testing, the PrEP Act preempts those state laws and expands the authority of pharmacists to order and administer this test during the emergency period. Connecticut has some more specific information about this. Connecticut statutes permit licensed pharmacists to administer COVID-19 tests, and as of May 7, 2020, Governor Lamont's Executive Order 7KK allows pharmacists to order Food and Drug FDA-approved tests for COVID-19 for the duration of the public health and civil preparedness emergency, unless earlier modified, extended, or terminated. The governor's emergency powers, including this executive order, have been extended by the legislature until March of 2021. So let's talk about the types of tests that are currently available. As a quick reminder, there are three types of COVID-19 tests: molecular tests, antigen tests, and antibody tests. We're going to talk primarily about serology testing in this training, since we covered molecular tests in Part 1. Many factors affect the results of serology testing and their clinical interpretation. In the early stages of infection, antibodies may be undetectable, and testing may cross-react with antibodies to other common coronaviruses. The clinical value of serology testing is still being studied, so keep that in mind. CDC does not recommend using antibody testing to diagnose acute infection. It can be used to identify people who have had the virus, but not whether they currently have it, nor can it be used to show that a patient does not have the disease. Also remember that you may only offer testing utilizing tests that 1. Have been authorized by the FDA under emergency use authorization, and 2. Are deemed to be CLIA waived. More about this in a minute. With that in mind, if you choose to offer antibody testing, make sure to choose an antibody test that have EUA, emergency use authorization from the FDA. Do not use antibody tests to determine a person's immune status until evidence confirms that antibodies provide protection, how much antibody is protective, and how long protection lasts. And always minimize false positive results by choosing an antibody test with high specificity and by testing populations and people who are likely to have had COVID-19. So how do we know which COVID tests are CLIA waived and under an FDA EUA? There are currently several diagnostic tests and one antibody test available under EUA for CLIA-waived labs. We went over the various differences in the authorized settings for the use of in vitro diagnostics under EUA in part 1 of this series, but for now, just a quick review. If you look at the chart there, you'll see that there, under authorized settings, are generally 3 letters, H, M, or W. H indicates authorized for use in laboratories certified to perform high complexity tests. M, authorized for use in laboratories certified to perform high complexity and moderate complexity tests. And W is for authorized for use in laboratories certified to perform high complexity and moderate complexity tests and are deemed to be CLIA waived for use in patient care settings operating under a CLIA certificate of waiver or certificate of compliance. So let's take a closer look at the list of currently authorized tests. As of October 20th, 2020, there are 7 molecular diagnostic tests authorized under EUA for use in CLIA waiver facilities. As you can see, this list continues to grow. The most recent one was added just at the beginning of October, and there were at least 3 tests added in September as well. When we published Part 1 back in May, there were at that time only 4 tests available for pharmacists to provide. It is also worth noting that some of these systems are authorized for testing for not only COVID, but also flu and in some cases other indications. The CFID Expert Express system, as you can see, for example, is authorized for COVID, flu, and RSV. And as you will see later, this may be relevant to your business needs. Along with the 7 molecular tests, there are currently 6 authorized antigen tests. Antigen tests are gaining traction in the market, largely based upon their lower cost and ease of use. And again, some of these systems too are approved for flu as well as COVID. Finally, there is now 1 authorized serology test, or antibody test. It is new to the market, having just been authorized in late September. As mentioned earlier, please note that unlike the molecular and antigen tests, this is an antibody test and only shows whether a patient has been infected with COVID in the past. It should not be used to diagnose active infection, nor to show that a patient does not have coronavirus. To see the full current list of all the tests that are available under FDA emergency use authorization, you can go to this website. The bit.ly address there is simply a shorter version of the one above. So go to bit.ly/FDA_EUAS, and you can see the entire list of authorized tests. Okay, so we have reviewed the proper nasal and transpharyngeal sampling procedures in Part 1, but given that serology tests are beginning to become available, let's review the procedures for serology tests. So just a quick review of all that. Allow the alcohol to dry naturally. Wipe away the first drop of blood. Squeeze the finger. Do not milk the finger. Do not directly touch or scrape the skin with the tube. If there are gaps in the collection tube, you may need another tube available to ensure enough sample. And then be sure to follow the manufacturer instructions to process the sample once you are done. All right, let's talk a little bit about patient assessment and counseling and what happens after you help triage patients based on who needs testing. So, patient arrives and you have to make the decision of whether they are symptomatic or asymptomatic. Has the patient had any symptoms consistent with COVID-19, including fever, cough, shortness of breath, difficulty breathing, chills, rigor, sore throat, headache, body muscle aches, new loss of taste and smell, etc.? If the answer is no, they are asymptomatic, then we ask the question, did the patient test positive for COVID-19 by a PCR test? If the answer there is no, did the patient test positive for COVID-19 by a serology test only? And if the answer there is no, then there is no isolation needed and the patient can be on their way. However, asymptomatic patient, did the patient test positive for COVID-19 by a PCR test? If the answer is yes, then we must go to isolation guidance. Stay at home or under isolation precautions for at least 10 days until at least 10 days have passed since the date of the first positive COVID-19 test collection, as long as the patient has remained asymptomatic. Well, what if they do not test positive via a PCR test? Then we check, did the patient test positive for COVID-19 by a serology test only? If yes, then there are some enhanced precautions that have to be taken. Consider getting a PCR test to help determine if the patient is currently infected or was previously exposed. Use a cloth face mask while outside the home for at least 10 days after the COVID test specimen was collected, and take everyday precautions to prevent the spread of COVID-19. And healthcare personnel and first responders should wear a surgical mask while providing patient care for 10 days after the COVID-19 test specimen was collected. Now, if the patient arrives symptomatic, we follow the other workflow. Is the patient previously symptomatic, now asymptomatic, and being retested at the end of their isolation period? No. Did the patient test positive for COVID-19 by PCR or serology test? If no, then again, isolation guidance, stay at home or under isolation precautions until at least 3 days, 72 hours have passed since the resolution of fever, etc. If yes is answered to any of these questions, is the patient previously symptomatic, now asymptomatic, and being retested at the end of the period? Did the patient test positive for COVID-19 by PCR? If yes, then isolation guidance is to stay at home or under isolation precautions until at least 10 days have passed since symptoms first appeared, and at least 3 days, 72 hours, have passed since resolution of symptoms. Now, once you've taken the test and received the results, there are certain reporting requirements. When COVID-19 tests are furnished without a physician's or non-physician practitioner's order, the COVID-19 during the health emergency, the laboratory conducting the tests is required to directly notify the patient of the results. And which other entities are required to report? All laboratories, including laboratories that such as pharmacies, shall report data for all testing completed for each individual tested within 24 hours of results being known or determined on a daily basis to the appropriate state or local public health department based on the individual's residence. You must report all test results, whether diagnostic or serology. In Connecticut, this means that you have to report the results to the Department of Public Health. And DPH has created an online gateway for reporting results of in-house testing. And that you can see that address here, dphsubmissions.ct.gov/COVID/initiate COVID report. Every COVID test, whether positive or negative, negative must be reported. All right, of course, even with all of this information, there is the big question of whether you can get paid for all this work and investment. The short answer is maybe. In late April, CMS issued second interim final rule regarding Medicare and Medicaid policy and regulatory revisions in response to the COVID-19 health emergency. Medicare will cover certain COVID-19 tests performed by pharmacists if the pharmacy is enrolled in Medicare as a laboratory, in accordance with scope and practice in state law. It is vital that pharmacists obtain their CLIA certificate of waiver in order to be able to even register as an enrolled laboratory with CMS. Pharmacists can also work with a physician or other practitioner to provide assessment and specimen collection services, and the physician or other practitioner can bill Medicare for the services under Incident to billing. Medicaid may cover COVID-19 tests, including tests administered in non-office settings, such as parking lots and other temporary outdoor locations, and laboratory processing of self-collected COVID-19 tests that are FDA authorized for self-collection. Likewise, Connecticut Medicaid will cover COVID testing under certain circumstances. The Connecticut Department of Social Services is offering COVID-19 testing coverage for uninsured children and adults in the Husky Health Program as part of the state's response to the COVID-19 emergency. Medicaid for the uninsured in COVID-19, it means that uninsured state residents of any income level may be eligible for free Medicaid coverage of COVID-19 testing and testing-related provider visits. This new federally funded Medicaid coverage group will cover both citizens and qualifying non-citizens for testing and testing-related provider visits incurred between March 18, 2020 and the end of the public health emergency. Connecticut residents who meet financial eligibility requirements but do not qualify for full Medicaid due to their immigration status, including undocumented individuals, are eligible to receive Medicaid to treat an emergency medical condition. COVID-19 testing and testing-related provider visits are emergency visits that will be covered by emergency Medicaid. Emergency Medicaid is not a factor in federal immigration public charge determinations. So there are essentially three routes for you to receive reimbursement for COVID-19 testing: as an independent lab, as an incident to, as we discussed earlier, and direct contract. And we'll go through these. The mechanism depends upon whether your facility has a CLIA waiver or not. If it does, make sure you are also enrolled with CMS as an independent clinical laboratory and enrolled in HRSA for uninsured patients. But there are also some alternative strategies you might be able to pursue. Getting registered for NPI and obtaining a CLIA waiver were covered in Part 1 of this training program, so we will not review them again here. But as a refresher, we will talk briefly about enrolling with CMS as an independent clinical provider, or independent clinical laboratory, or Pharmacies can enroll for a CMS provider transaction number, or PTAN, in three different ways. Utilizing the temporary hotline that CMS has set up, you will need to submit and pay for your application within 30 days of when the 1135 waiver is lifted, which will be towards the end of the emergency period. 2, PCOS, the online Medicare enrollment system, which the enrollment is good for 5 years. Or 3, classic paper application, good for 5 years. In all cases, the $596 enrollment fee is waived now for all pharmacy services. Option 1, as I said, phone call to a temporary CMS enrollment hotline. The exact phone number depends upon your geographic location, so you need to click through to find your specific number. The addresses are there on the screen. Go there to find your specific hotline number. But note that by using the hotline, temporary Medicare billing privileges are generally effective within about 2 business days, so it's a quick turnaround. Option 2 is to enroll through PCOS, the online Medicare enrollment site. This has a couple of advantages over the hotline. especially that you may simultaneously sign up for flu testing and other clinical laboratory services for future growth. And also, if you are not currently enrolled to immunize, now is the time to enroll for that service in addition to COVID testing, as both are free. There is no fee at the moment. All of that, only the COVID can be done via the hotline. The online PICO system allows you to sign up for these other programs as well. And of course, finally, there is the option to enroll the old-fashioned way with a paper application, which you can download from the CMS site. Use Form 855I if you're a sole proprietor. Use Form 855B if it's an organization, corporation, or LLC. And just FYI, on top of this, use Form 855S if you also want to register for DME billing. A couple of notes about the Medicare enrollment paperwork. Be sure to enroll as an independent clinical laboratory, not as an independent diagnostic testing facility. And for immunizing clinical services, be sure to enroll as a pharmacy, not as a mass immunizer. Enrolling as a pharmacy allows you to grow your services in the future, whereas mass immunizer only allows you to bill for influenza or pneumonia and not other indications. If you are already registered with CMS as both a pharmacy, Medicare B vaccines, DSME, and you are now in addition becoming an independent clinical laboratory, you will have 2 PTANs. Be sure to reach out to your billing team to ensure that they have appropriate knowledge for billing for COVID testing and how the 2 PTANs will work in their system. They may need to physically change the PTAN with each transaction. Quick summary then of CMS billing during the emergency. If you are enrolled as an ICL, Medicare will cover COVID-19 tests performed by pharmacists, specimen collection for homebound or SNF patients, and for flu and RSV tests performed in conjunction with COVID-19 diagnostic testing. Okay, talk a minute about HRSA for just a second. According to the CARES Act, providers who have conducted COVID-19 testing or provided treatment for uninsured individuals with COVID-19 on or after February 4th, 2020, can begin the process to file claims for reimbursement for testing and treating the uninsured. Providers can access the portal at coviduninsuredclaim.linkhealth.com, and you can also click through to the frequently asked questions and get a little more information about that if you need it. Now, some alternative strategies if your patient is not covered by Medicare or Connecticut Medicaid. First, talking about private insurance. Reach out to commercial health plans about credentialing and testing or about enabling your pharmacy to submit a claim to a PBM. In these cases, the claim will have a product identifier, an 11-digit NDC derived from the UPC or UDI on the kit for the test, plus a professional service code, for example, PT, meaning performed laboratory test. In September, the National Council of Prescription Drug Programs published urgent industry guidance to aid pharmacists in expanding COVID-19 testing across the country. The NCPDP Emergency Preparedness Information Document has been updated with specific guidance related to pharmacist-led COVID-19 testing, as well as other updates that provide standards-based guidance and resources to the pharmacy industry during a declared national emergency, such as a natural disaster or a pandemic. Of course, you may bill your patient directly. The COVID test is, in fact, HSA and FSA eligible. If the patient pays cash, be sure to provide a summary of services and price for their tax records. Finally, some pharmacies across the country have contracted with local self-insured employers offering to conduct COVID testing at the company's worksite or for the company's employees at the pharmacy itself. Okay, but what if your pharmacy does not have a CLIA waiver? Well, there are still some options for reimbursement. First, Medicare has temporarily relaxed the need for direct supervision, which allows remote supervision in pharmacies not housed within doctors' offices. Pharmacists can enter into incident to physician services arrangements to provide evaluation and management services to be provided via telehealth. The provider may submit the claim and pay the pharmacy according to the terms of the contract. And you can see that the incident to billing code of 99211. Second, your pharmacy can act as a collection site. Remember, a collection site does not require a CLIA waiver. You can contract with a laboratory to be a collection site, for example, for that lab. You can obtain supplies from the lab, perform only sample collection, deliver samples back to the laboratory, and of course the lab is responsible for reporting to the patient and to the public health agencies, and then arrange for payment directly from the laboratory to the pharmacy. An extension of the previous concept, your pharmacy can contract with the local employer to provide COVID-19 assessment and specimen collection at the company's worksite, at the pharmacy, or at another testing site. You can do the sample collection, but remember that either you or the employer would need to contract with a laboratory to perform the actual analysis. Again, the laboratory would be responsible for reporting to the patient and to government agencies. Thank you for viewing this program. We hope it was helpful. For more information on all of this, please visit the CPA COVID Resource Center at ctpharmacist.org/COVID-19-resource-center. Have a great day, and thank you very much.